Yeah, I'm gonna do it right now.
All right. Okay, we're live officially.
All right.
Welcome
All
to
right.
our loyal followers. It's Friday on a Saturday.
I
Yay!
feel like it's definitely Saturday. I'm definitely in Saturday mode. I mean, I'm always an REI clothing model, and today is no exception. All
You
days are
know
the
what?
same.
Hold on. I'll pull you up real quick here because clearly I didn't prep well enough for Friday on a Saturday to actually
No,
do
no.
do my templates in advance. But here we go. Yeah, you are an REI model. It
REI.
is super hot in
REI.
Atlanta again, so I'm back to
Mm,
summer cat
no.
here. Yep, yep, yep.
It's raining
Oh
here.
my
We have enough
goodness.
rain. We are no longer in a drought in California as of like a week ago, and it is raining actively. And if I had a bathtub, I would take a bath, but I don't because I'm in home renovation now. But other than that, it's like
Under
raining, super
construction.
green, really nice.
Under
So
construction. Well, it's always
yeah,
raining in Atlanta, so here I am. Here I am. But welcome to Friday on a Saturday. Lisa and I were both traveling this week, like we always do, but unusually so on Friday. Lisa was at the Combo Sequoia Project eHealth Exchange conference. We have a special correspondent to tell us about that as
I
well.
know.
I was at the Behavioral Health Tech Conference in Phoenix. We have a video from someone else about that, but like mostly my opinion is more important than his, and it was great. So it was a great time all around, but like there was some other stuff that happened this week that Lisa's going to tell us about.
A lot, a lot, a lot. So
What
so
even
first of
happened? I
all,
don't even know.
no, so it's like news that crosses like health tech and every other tech, which is that out of the blue, Sam Altman, the CEO of OpenAI, former, I don't think he was the creator, but he was the CEO of Y Combinator, fired, fired by the board. As our
Fired by
loyal
the board
watchers know,
energy.
I love fired by the board energy, and he really has it. And what I can't get over is the fact that people are like, how could this happen? It's like, well, the board is his boss,
Well, so
and the board
so
was like,
Lisa
we're
says
gonna fire you.
people say. Lisa said people
People
say
say,
that. I said that. I was like, how did this happen, Lisa?
no, no, Pat,
Tell us
Pat.
more.
There, the all over the stupid internet, over Twitter, over Threads, over every other channel is like, how could this possibly happen? How could they destroy this like bastion of capitalism? It's like because they literally structured it to be a non-profit holding entity because they were like, AI is going to kill us all, and we need this to be a non-profit that only cares about like not killing people. And so that's how they structured it. It's literally all there is to it. Like he didn't have any shares. Nobody has any shares. It's a nonprofit. You don't have shares. I run a nonprofit. I don't have any shares. I report to the board. The board can fire me. That's how it works. And so that's what they did. The other thing that's really kind of twitchy about it, there's so many things, but they don't know why. No one's really said the real story, like why it happened. But there are lots and lots of rumors. One of the rumors is he was taking money from some shady, let's call it a sovereign wealth funds to create a venture fund to make a lot of money off of stuff. And they're like, we don't just make money, like we're here to like not kill humanity. And so they were mad about that, or just like things like that. So that could be what happened. But the point is, they fired him. The bad thing is, as well, is that the board members, of which there are very few, at least a couple of them are part of the effective altruism movement. You might know it from Sam Bankman-Fried, the guy who's like in prison right now, like waiting. It's not good. It's not good. Like nobody there is good. Like there's nobody there is good. That's my summary.
So it's
So
like the
fired
same.
by,
I didn't know it was the same crowd. It's the same crowd that's trying to save America
oh
while
yeah,
corrupting the
oh
whole thing at the
yeah,
same time. Oh, I didn't
yeah,
know that. See, this is why I
yeah,
need you. I just need you. I need you in my life for
yeah.
many things, Lisa, as we found out this week. But
As we did. So
yeah,
effective
no.
altruism strikes again, and OpenAI is falling apart. That's the summary.
And this is why we should just go straight capitalism. That's what I'm talking about, right? Like, is that basically the lesson that we
So
learned, Lisa? I don't know. I think you might be saying something different, but
not the lesson that I learned, but also like hilarious how upset people are about this very rich person who will be extraordinarily fine, who got fired by the board. The problem is, like, OpenAI was making like some pretty good stuff, and now if everyone leaves because they're like, oh my God, like the board can just fire people, then they might not keep making good stuff. I don't know.
I don't know either. Who knows? Who knows what that guy was? You never know if like the leader is
Who
just like the
knows?
spokesperson or if it's like a
Uh-uh.
real leader. I mean, he was
Mm,
showboating around, which, I obviously appreciate as a showboater myself. But
So
Who
he's a
knows? Who
showbunner and he was
knows?
showbunning around, and that's what he does. He was like, I'm the CEO, I recruit the talent. But the CTO, who is now the interim CEO, a slightly younger woman, Mira Murati, she is apparently very qualified, has done amazing work in the AI space. People like her. But here's the thing, as you know, when the CEO gets fired by the board, who do they bring in to clean it up? Who do they bring to clean it up, Kat? Come on. Who gets the cleanup job? Is it
Gets
another
the
guy?
cleanup job. Is it a
It's
woman who we can
a
fire
woman.
easily?
It's a woman. Yeah. Who's gonna be
I
scapegoated?
should. That's a sad
Ah,
laugh. That was a sad laugh. In case no one could
yeah,
hear that, but
yeah, yeah.
yeah. Well, maybe it won't.
You know,
Maybe it won't go
Kat,
that way because we got the altruism going on. We have the altruists
yeah,
here.
I'm not sure about that. You know what I heard, Kat, though? I heard that there is just a time and a place for fierce women. And it might be the time and place when you're about to fire them or blame them for taking down an entire company and billions of dollars. I don't know. That's
Yeah,
the time and the
it could
place,
be
right?
it.
The time and the
I
place.
have heard. I have heard that. I
Oh,
have heard that. But you know what? You
yeah.
know what we're not gonna do
Hmm.
here? Give those motherfuckers
Hmm.
any oxygen. So, but no. Speaking of AI. So I'm interested. Oh, we got this guy fired. Fired by the board. Again, we do love
Yeah.
people with fired by the board energy. High
Love
five
it.
to Jonathan Bush. High five.
Amazing.
So I was at this behavioral health conference, and we can talk about that in a little bit because we do have to get our special guest with a time limited situation going on here.
Mm. Mm.
But at this behavioral health conference, most people were like, AI is just going to be like blockchain. Like, we're all going to talk about it and it's not going to work. And I was like, oh, it's kind
I
of already.
don't think so. I don't think so. I think we're dealing with something quite different here, and the only hope we have is that they will use it for good. And after all, the algorithm might disagree, the entity, the intelligence might disagree, and we might take us all over anyway. It probably is already happening, right?
Maybe. I don't know. I don't
I
know.
mean,
I
that's
mean, you could
probably why
also
Sam was
just,
fired.
you think?
Mm, it's
I
taking
hope
over.
it was something more dramatic. I hope it was something more dramatic than that.
Yeah,
But anyway,
yeah.
all right, okay, all right. So, do you want to? We have to bring our first guest here. I have
Yes,
a video that
do it.
Desiree sent, like some music you guys were listening to. We can
Oh
play it if you want to.
man,
All right, here. So you guys apparently.
yes.
I'm not really sure. Okay,
I
there's the
think Sam
music.
was there for this part.
Yeah. Apparently you guys were totally rocking. So anyway, we'll go. We'll
This
go
is
to like the
Clifford
real
and
deal
Friends.
here.
I'm just going to give a shout out. That's Clifford and Friends, this
Yeah.
San Diego musical artists who are a bunch of other people bringing. He brought a bunch of singers up too later after
Mhm.
Sam went to bed because he's a dad. But
Yeah,
it was great.
yeah, yeah,
Clifford and
yeah,
Friends.
yeah.
Yeah.
Was a
I could
dad.
I could watch that bass player. He was just incredible.
Oh,
Just
good.
unreal. Yeah. Yeah.
Who are you? By the way, who are we and who are you?
Yeah,
We always
who
forget
are
who
Oh
people
you?
here.
yeah.
Oh my god.
My
Man.
name's I'm also a Sam. So it was a bad week for Sam's with SBF
Bad week for
and
Sam.
Altman. So I'm Sam Rudes.
Sam, and Sam. Oh my God, it's a
Yeah.
conspiracy.
It's
Amazing.
rule of
We did it.
threes, so I think I'm next. So
Oh
yeah.
no. Does your
So
boss know you're here?
I don't think
No,
so. I'm
I
not
don't
sure.
think so. I
Yeah.
That's
saw him
good.
and I didn't tell him.
That's all good.
I don't
It's
know
all
if he
good. Yeah.
watches the show. I don't know.
Yeah.
Well,
So
is
yeah.
he gonna introduce himself?
Oh
Sam,
yeah. So
Sam,
I'm Sam Rudes. Can you hear me? Everyone hear me?
we can
All
hear
right.
you.
Cool. Cool.
Yeah, yeah, we can
Yeah.
hear you.
So
Here.
I do policy stuff for the New York eHealth Collaborative. My real title is the Privacy and Compliance Manager. But
Sounds
Policy
cool.
yeah,
stuff.
it's fun. Yeah, it's pretty. Yeah, I really like it. So I got to attend the Sequoia Project annual meeting this year. I missed Civitas because my wife was
Wow.
like 9 months pregnant, and
Wow.
I could have made it. I could have made it though because the baby didn't come until like the next week or the week after. So
You never know. These babies,
really,
they come when they come. So
really feeling robbed by that. So I just hope she's cool.
Yeah.
But yeah. Otherwise,
yeah.
thanks for having me on.
So Sam's like a cool person in the industry that we know about, and
Hmm.
we like invite him to our stuff, and he's pretty fun. And when we found out that he was going to be a special correspondent, we were super thrilled because he's like he was on paternity leave, like he couldn't come in, and I think he also was kind of worried that he'd get fired, but he's here now. So you and Lisa did the thing. You went drinking, you
Yeah.
went policying, you went
Mhm.
paneling. Like, tell us about all the things. Was it worth it?
I would say yeah. Yeah, I mean, I was just thinking about, and I don't know if Lisa has the same opinion, but just thinking about even last year to this year, bigger venue, more people, the first day panels. I didn't want to miss a single panel or conversation. So yeah, I think there's like momentum happening with this, this Tefka thing that everyone is talking about, and I think I don't know, it was just well, I get excited when there's opportunities to like collaborate, and I feel like in this industry in particular, being 4 years into it, I feel like that comes out in these conferences is this kind of notion of we're learning things together and we're running problems by each other. And as someone who joined the industry when the pandemic first started and made all of my friends like you two by Twitter, the two of you just through Twitter, it's really cool to meet people in person,
Yeah.
and to see them for the first time. And there was some folks there that, yeah, I've been interacting with for 4 years, but had never been in the same room with. So it was really cool. Yeah.
Yeah,
Yeah.
I mean, I guess I would say just like think, I don't think I'm insulting the Sequoia
Yep.
team when I say this. Like they really, this is the first time they tried to do like a conference, like not just like a 1 day summit situation.
Yep.
And I'm actually really surprised that it took so long. I think it's because of the pandemic, right? They were like, let me do this, do not do this. And then finally, like, okay, we're going to do this. As someone
Mhm.
who runs conferences, unfortunately, I don't want to. It takes a long time to plan them. Like it's really hard. It takes like forever and you have to like coordinate a bazillion people and the location is a whole nother situation. So I think that, I'm hopeful that they will like continue to build it out and make it something that's like more engaging for different types of folks and has different types of offerings. But
Mhm.
this was really their first go of like, we're going to do a conference. And, I mean, now they're trying to launch Ye Olde Tefka. You all know my feelings about that. And that's an uphill
Did you
battle.
say
I
ye
don't know
old
that this
Jeff?
Ye Olde Tefka it is Ye Olde Tefka. It was from 2015. Like this, it's 100 years ago. I am like
It is old
ancient now. I have
timey.
like back
Mhm.
pain. Like when it came out, I didn't have like back pain. I had fewer gray hairs. Like I hadn't had like basal cell carcinoma. This is a long time ago, you guys. I was a tween.
Mhm.
Like I was like at least like maybe 13, 14. I don't know. It was a long time ago.
Yeah.
So, it's been a while.
You were a
With that.
child. You were a
Thank you.
child. It's
I
true.
was a
And now
child.
here we are.
Yeah.
Sam's had like 4 babies since then. Like
Yeah,
everything,
It's
everything has
true.
how many
happened.
children
Yeah.
have you had since Kefka was written, Sam? All of
3.
them, right?
Yes, all 3.
Exactly.
All 3. Yep.
3. That's like replacement
Wow. Yeah,
numbers.
that's a lot
You
of.
replaced you and your wife plus 1 in
Mhm.
that time. So
Mhm.
Ye
Yeah.
Olde Tefka.
Yeah. Yeah, that's pretty
Shame.
intense. Well, we
Yeah.
heard that Q-Hens are going to be real on the 12th of December. Some
Ooh,
of them, not
maybe.
all. We
Yep.
still don't know which of the two are going to get no-goed. We don't
Yeah.
know. We don't
And
even know what's going to
there
happen.
is some sort of secret QHIN that's working its way through the pipeline right now.
Secret UN.
Yeah, yeah. I think I'm not
Uh,
going to say who I've been tracking, but the announcements that were
I'm
just
gonna say it.
made.
It's Sure Scripts is coming out. Like I don't know who
No,
told
but
me that. It
no, but
wasn't
they announced
you.
no, but they announced that. They
Oh, did
announced
they
that,
announce
and then
that? Yeah,
whatchamahell, the other
that's been
group.
announced before.
Um,
I don't know. There's
yeah.
Sure
two that are
Oh,
Scripts.
making their way up
yeah,
the
but no, they
path.
were
Well,
announced
Velatura,
though, y'all. That's not secret.
Velatura, USQHIN, and Share Scripts were totally announced. That was not like a secret, Sam. You can say non-secrets here.
Okay, is there a secreter one than that though? Is there
I
a
think
secreter
Yeah.
I think we're
one?
gonna
Okay.
see a secreter one than that. If
Okay.
that's a
A
good way to
secreter
say it.
one. Okay. Okay. Okay.
Sam,
Okay. Okay. Okay.
what? Do you have so you have real dirt here? Like this is a real
No,
dirty
no,
dirt?
this is me
Ooh.
looking at timelines and what they're allowed to say and when they're
Oh.
allowed to say it. And the last,
What the
yeah. So
hell? Sam, I
uh,
did not know you were coming with this hot dirty dirt.
no,
Like,
it's not. It just you could
Information
Google it.
security around QNs is like very poor. So I feel like we
Actually,
can probably figure out who it is.
I actually asked ChatGPT and they were able to give me the answer. So
Nice.
oh.
hmm
That's
hmm
Wait,
good.
can
That's
someone do
good.
that right now and figure out who it is?
I
I
can do
don't know
it.
who it is.
Hang
I've
on.
been like in the black hole. I've been doing stuff. I don't know. I don't know who it is. Someone asked
I'm one
ChatGPT who
of
the
the
other Q
other
is.
like goobers who pays Sam Altman until yesterday for a Chat GPT subscription. So give me a second. I'm on it.
Okay. Oh, when Lisa does that, so we should tell everyone we have made modifications to our show to improve it. We still are a $0
Ooh.
budget operation, but we have a new ongoing moderator, so who will actually look at our comments, because as you know, it's total trash on LinkedIn Live. Said no one. So Melissa Danino is monitoring our comments for us, and she just let us know that Nadine Peever, who is also a regular on our show, asks, isn't December 12th the original date of the apocalypse? I mean, I don't know. No, but we know there's some crazy stuff's going to happen on December 12th from 9 to 10. Lisa and I may or may not be there.
I thought it was November, but I could be wrong. Yeah.
Oh, November 12th? Oh, I actually don't know when the apocalypse was supposed to be or is going to be, but I'm sure someone, you know what, Lisa, you'll tell me. Oh, they do? Yeah, okay.
That's the thing. It's a moving target, the apocalypse.
Yeah. Oh, man. Okay, that's good to know. So Lisa and I, we might go to the QAnon thing.
It's still doing, like a chat. They keep doing updates amazingly. ChatGPT is incredible. They are still doing updates, but now they're doing it where they show you all the places that they're searching. That's even better. That's almost
okay. Has it told us yet? Has our overlord told us? Oh my God. Okay. Anyway, well, I'm excited. You know, the timing of this QAnon party is bad, right? Because then we got the other meeting. I have to not get divorced, so I can't travel that much. It's gonna be real hard. We're not sure. We're not sure what's going to happen. But okay, Sam, while we figure out who the other QAnon is, I'm so excited that you got the dirty dirt here. Like, it's very exciting.
No, that's what I'm saying. I don't know what the secret one is. So.
Oh, what the heck? Sam!
But there is a secret one. That's what I'm saying.
If you're in the chat right now, tell us the answer. And you know.
Yeah, someone tell us who the secret QAnon is.
This is a very low stake situation. There's no money behind this. Like the stakes are extraordinarily low, you guys.
Well, there is. I mean, people have to spend a lot of money behind it, right? Yeah. Like, you know, but no one's getting any money. Right. So unless they learn, unless someone is real freaking good at commercialization, which but listen, as someone who does a lot of data acquisition, it's going to be hard to commercialize this shit. Is what I say. I say. Okay, did ChatGPT come up with anything yet, or are we still waiting? Okay,
it's thinking right now. It's searching the entire internet currently.
Who is the secret QAnon? Okay, whatever. The apocalypse is coming. Sam, what was did you go to, because I know these are two conferences, but in my mind they're one. Did you go to both? And what is your hot take from each?
I do this all the time.
Yeah, so I missed.
This is so upsetting. Apparently, I do this. I'm sorry. I just looking at myself, I realize I do this all the time, which is like Mr. Burns. I think is my Mr. Burns impression.
Lisa, I have never seen you do that.
Number one impression.
Hold on.
Sam is on the floor in his childhood home. In case everyone.
This is Cal.
Cal. Hey, Cal.
You gotta head downstairs, buddy. He's got a flashlight for some reason. Okay.
He's in the closet. Buddy. Oh my God, this is.
All right. So I did not attend the eHealth conference, so I did the joint Care Quality Sequoia project. That was the last Wednesday, Thursday, Friday. And I don't know, I guess like they had dropped some news about the Common Agreement 2.0 that I thought was kind of interesting way that they're framing it of I think it's streamlined and flexible. Were the terms that were used, and we'll see how that kind of what that looks like, because 1.1 had some minor track changes, and I don't know how folks feel about that, and now they're outside the door trying to like get in, so I'm just gonna
of course. I just want to know we have a new conspiracy theory that's dropped in the chat again by Nadine. She heard that Sam Altman wasn't actually fired, that he resigned to start the new QAnon. So that's a great, amazing conspiracy. I'll buy that. I mean, wow.
I feel like that guy could commercialize. I feel like he could commercialize the QAnon thing. I feel like he could do it. He could make it happen. Yeah. Interesting. Mm-hmm. Well, wait. So Lisa sent. So one thing Lisa did send me that I remember this week was that she sent me a thing about QAnons, and it was the particle guy whose name I've forgotten. Mm-hmm. Troy. Did the thing on LinkedIn, and most people mostly agreed with him, and he was like, this is why Tefka's bullshit. And he was saying in the new Common Agreement, you don't have to respond to a patient query.
Correct. That's
okay.
Correct.
So like the only reason I feel like Tefka is rad, like the only thing that I feel like is like worth, as someone who does a lot of data acquisition, I say this with love. There's no other real way to get patient data, like patient stuff. You can't really do it, right? And I thought that was like the only reason we even had Tefka. Like, and now it's like, nah, you don't have to do that if you don't want to. Like, am I misreading this? Because again, I read it off a LinkedIn post. I did not go to the Sequoia meeting.
There's not a duty. There's sort of a duty to respond, but not really. I mean, there's plenty of ways to get around it, and then making it required. That's the part that Tefka doesn't do, right? Tefka by itself doesn't make anything. You don't have to join Tefka, but what you do have to do is if they ever close a loop and make it be something required in programs like in Medicare or in some other program through CMS, then they can say, well, you have to do it through CMS. But as you probably know, the enforcement mechanisms through CMS are very delayed in many cases, very slow. They rely on things like attestation, which means that you just say like, I did it, or I did it once out of like 1 trillion queries. And then they also do things, and when they do enforcement, they do what's called survey and certification, where they actually like have people who are like in all the regions who go out and actually like visit hospitals and say like, are you doing this or not? It takes a really long time to enforce this on the ground. So you have to really just depend people are going to do it because I think it's a good idea, and then just hope that everything catches up to them eventually. So there are a bunch of polls, as we have all discussed, as the proponents of TEFCA have also discussed, right? To be fair. But I thought that, I think it's Troy, sorry, Troy, if that's your name, Bannister, Troy, darn it, who wrote kind of a good sort of side-by-side of like the current national networks and like what we're proposing with TEFCA right now.
God bless the national networks.
Yeah. You could just go to Commonwealth eHealth Exchange and just get what you need right now, today.
Yeah. You can
Already
totally
live.
do that. Well, it bums me out because, like there's no, like, listen, as someone who makes a lot of money off commercializing things, there's like no real way to make money off of like a patient going to, I know we're going to have a guest talking about other patient access stuff, but like, as like Kat McDavitt being like, I would really like all my records. Like, there's no real way to make a lot of money off that as a vendor. So like, you almost have to regulate the shit out of that. And they're like, well, we'll do that later. Like, I don't know. I'm kind of bummed.
Yeah.
I'm kind of bummed about it.
Yeah.
I don't know. Sam, what do you think as our policy expert?
I think they just have
Are
to.
you allowed to say any of this? Just do a sign if you can't talk about it. If you're,
Wink.
We don't want to.
Blink.
No,
whatever.
as long as it's not work that we're currently doing, I can talk about it. I think. I hope that's what my HR told me. But I think everyone should just watch a recording of Grace Cordovano, and then that'll solve everyone's issues. I think so, because like her framing and all of her panels are just always phenomenal for me. She has actually like changed my mind on issues like
nice
sufficiently. It's so I just think that should be like required viewing for QHINs and their participants and sub participants. But
Grace is awesome. She's going to come on our show when she is not traveling, which is every day.
Probably never. Yeah.
Every day she's traveling.
She did say next. If we haven't decided, are we doing a show next week? We'll figure that out later. We'll figure that out tomorrow.
Thanks.
Okay, we're not. Yeah. Okay, that was the only date I think before
we're
Christmas.
Eating.
But I don't know. Yeah. Okay. So Sam, you're not going to really comment on that. You're gonna punt that.
Yeah, I'll punt it.
Nope. So Sam, we have a few more important points. Specifically, lots of threatening talk about we're going to discuss the Marvel Cinematic Universe. So just want to give you a moment to say your piece on the MCU. Where we are today.
It's just impossible to keep up with it. Like Marvel fatigue is real. Like and
narrative debt.
Yeah.
It's called narrative debt, Sam.
Yeah.
Narrative debt.
Like it.
The hardest part for me is that there'll be a series that'll come out, and maybe they'll have like it'll start out great, but then it just kind of fizzles out, and then but it's relevant to the whole universe. But if I know it's going to not pay off, I don't have the time to watch, because it's 30 minutes,
12 hours,
or whatever, to watch a show that's not really worth it. And if that's the narrative, I don't know. Has anyone seen the Marvels yet?
Cliff Notes. No, and I'm not.
No, because I heard it was trash. Everyone said it was trash. Didn't Bob Iger actually say it was trash and he was taking over?
Yeah, they make a movie that's like all women, and they're like, and it sucks. Sorry that it's like 400 years after we've had like 75 shows that no one wants to watch because they're all too complicated, right? That's how I feel.
I'm sorry, Sam.
I'm
sorry, guys.
Shame. I just knew there was like a big scene with cats, so that's really like what I was kind of excited about.
Interested in. Maybe next time I'll
Oh
bring
my
our security footage of all the, basically we have a cat superhighway behind our house where all the neighborhood cats kind of like walk over the fence.
That's
So
important.
next time I'll bring
Mm.
some cat footage to spice it up here.
Nice.
Good report. Good report. Good report. All
Okay,
right, like
where are you
what else,
going?
Sam?
Where are you going, Sam? What's happening
Where's
next?
the
Where are you
tractor
going
pull?
So
What's
after
I,
this?
happening?
so I am on my way to the annual Greenwich, New York Holiday Lighted Tractor Parade, where 70
Shit.
tractors will be covered in Christmas lights, and they will be paraded through my town, my hometown. Yeah, and it's a huge
Mm.
thing. I think it was in the New York Times maybe
Oh my
once or
god.
something. I don't know. It's big, and
Incredible.
and last year my dad was the what is it, grandmaster or whatever that.
Isn't your dad like the mayor or something?
He should be. He should be. He's just a math teacher that was like here for
Aw,
35 years. So yeah,
He's basically the mayor.
amazing.
Basically the
yeah,
mayor.
more or less. But yeah, I
Sounds
should
like the
probably
mayor.
pack up the car and head
Okay.
that
All
way.
right.
But
Sam's got to go to the tractor pool with the lights.
yeah,
Sam, you're the best.
all
We'll have you
right.
back on. Please send pictures. We'll put them in our comments for our show
Yeah.
Okay,
recap.
I can do
Tractor
that.
pull.
All right,
Yeah, it's
We're into that.
basically going to be good. Here, we're going to, all right, Sam, you go.
have a
Thanks
good
for the
one.
hot takes.
Yep.
All right, we're going to have Melissa and Meredith for a second so everyone can see the amazing
Hi.
Melissa who is moderating our comments. Also, new comment, also from Nadine, who's basically freaking crushing it on our Saturday talk show on a Friday. Well, whatever. Nadine says it's only a Q hint if it's from the expensive region of digital health. Otherwise, it's just sparkling clear quality. Oh, that's pretty funny.
I gotta agree.
So
I gotta agree.
Melissa's in the lower right. She's our moderator. She's going to read stuff at her or at us. Well, I don't know. But anyway, we're trying to not do this the entire time we're on this talk show. All right. And that's Meredith in the upper right. So hold on. We're going to kick Melissa off. We're going to have Meredith over here. All right. So we met Meredith, Melissa and I, and Nadine at the Commonwealth annual meeting. Actually, it sounds like Melissa had met her earlier and was all over her because they are now friends. And that's just how Melissa is. So, and then she actually told me what you did. I saw your session. And you should probably tell us about that rather than me. Yeah, we have more comments for a special break here, but yeah. So Meredith, tell us what you do. Tell us what you're all about. And then we're going to ask you a bunch of questions about Q hints and shit.
You will. Maybe. Good luck with that. Right. Yeah. Sometimes I feel like I'm drinking from a fire hose. So, because this is not my mothership, the health IT medical world. I come from the legal industry for the past 30 years in specializing in record retrieval. Right. So I've worked for insurance companies, pharmaceutical companies, law firms. I've been the end user you name it, have my own record retrieval company. So needless to say, if someone needed to get records, any type of records on anybody, I was your girl. That's my thing.
Nice.
Right. So, and I always like to be different or unique. And then in 2018, my daughter suffered a traumatic brain injury, which was crazy. And all right. So I systematically chose the hospital system and made sure that all of her specialists, as one by one, she ended up with 22 at the end of it all, specialists to coordinate her care, right? Because it was just one thing after another. So they're all in the same hospital system. They're all on the same EHR. But as we start down this journey, the right hand can't see what the left hand is doing. And to the extent that my daughter's hematologist would call in, or we would call in to my daughter's hematologist, and we say, hey, listen, we think we have a suspected blood clot. Should we go to the ER? She's like, yep, I'm going to call ahead. Send her, they'll meet you there. They know you're coming. All good. Okay, so she is my daughter's hematologist in this hospital building on this EHR on the same floor that they're going to, if my daughter has a blood clot, that they're going to admit us to, right? We get there, sure enough, she has a blood clot. We're admitted to the 4th floor. So, 2 days into our week-long stay, I'm like, I wonder if Dr. Zia knows this. Like, why haven't we seen her? I mean, I know there are ER doctors, but like, really? So come to find out, Dr. Zia doesn't find out till 2 weeks later my daughter was admitted. And she's on the 4th floor. So from here on out, every time my daughter's admitted, even though Dr. Zia was the one to call and give the ER heads up we're coming, I literally would run down the hallway and say, knock on the door when they opened, 9:00 on a weekday, if it was on the weekend, and say, hey, by the way, we're admitted. Dr. Zia would come down the other way. Are you kidding me? This was 2019. That's insane. That is absolutely insane. Right?
That is less old than Tefka.
Yeah, I know. You would think. So you would think if they're all on the same system, right? They would know how to access each other's
Yeah.
information to see, I was about to just say names and everything. So, but to see what neurologists
we're
are
okay
doing.
with that.
Okay, cool. So to see what Remy's neurologist was saying or what they're prescribing, right? Because then she ends up with double medications. I'm like, I'm sorry. So we're sitting with like the neurologist. I'm like, so you can't see what Dr. Johnson's doing or Dr. Z is doing? And they're like, no. And I was like, oh my God, why the hell did we like? So then fast forward, they're like, listen, your daughter we can't figure this out. Like, which came first, chicken or the egg? Was it the traumatic brain injury? These other things. So they sent us up to the Mayo Clinic. Mayo Clinic was like, yes, we will see her. I was like, thank God. So we're going to be there for 9 days. I don't know if anyone is familiar with the Mayo Clinic, like, and how they operate, but they like 3 months in advance, they schedule out how long you're going to be there, and all the doctors like systematically back to back to back, so that they just keep going over your case from a collective approach. Coolest thing I've ever seen. So they accept her case, which was the only hurdle in my opinion. And then they said, but you need to get all the medical records and bring them up to us. I was like, I totally got that. So I thought I could not get all of her records. And I was like, oh, now I'm really mad. Like, so I'm scared out of my mind because I'm a mom, right? But now I'm angry because I cannot get all of her data. And I was like, what do you mean?
And this is what you do, right? This is what you do for a living at this point. Okay. Okay.
So what does the common mother or father or caretaker, what do they do? Like, I know how to work the system. I mean, I just do. I knew how long it would take. I knew there would be an expense. I knew who to call, and could not get everything up to them, and can't get everything out of the Mayo Clinic to all of her providers. So how do you take care of a patient that way? And then the pandemic hit. And I was like, oh, now this is going to be fun. So it became my mission. Like, I had a little extra time on my hand while I'm working, could go down those rabbit holes. And that was it. I was like, there has got to be a way to do this, whether we're empowering the providers or the patient. To what you guys were saying, I think the patient should get this stuff for free. So totally agree. It should not be monetized or can't be monetized for the patient. And the providers, like, they don't walk into an operating room and expect to bring their own scalpel. Why would they think they would have to bring their own records to look at a patient, before you sit there? And it's just insane. And then, we opened up as we started getting records and able to give them to the providers. They were like, oh, wait, because then it was data overload. So my daughter was a minor when this happened. Now she's an adult. So we hand her new neurologist 22,000 pages of medical records. And he was like, wow, this is awesome.
What do I do with these?
Yes. And he's like, wow. Okay, well, and I was like, okay, I didn't even like put all this together. Yeah, I guess we probably need to figure out a way to sift through this information and make it usable, or it's crazy. So now we have problem number
something.
But it's okay. We're chunking through it piece by piece. And I'm learning.
There's so many problems here, right? And the first one is there's also a great a commentary from a physician on stage at the Sequoia conference, or the care quality part of the Sequoia conference on, I think, day 2, said, if you give me any more data, I'm gonna leave.
Yes.
Right? Like, I need information, not data. And in you having to, unfortunately, the only way that they'll give it to you is this like 22,000 pages or whatever, right? And that is not information. And that's not even data that's been broken down into elemental data to, data elements that can be shared in a computable format. Like, that's not that. It's just here is 75,000 like copy paste and like maybe one little nugget of information.
Yep. No, it's insane. And it's duplicative, which is okay, fine. Right. I'd rather have it than I'll figure out how to sift through it. So that's the great part. At least we're starting to be able to sift through it. And because we've been able to run so many, we're obviously learning as we go, which that's a lot of learning because the providers are learning and the systems are learning at the same time, as are the networks.
Did you also, Meredith, when you were pulling these 3,000 billion pages, like Lisa and I have talked about before, like some of this data is like total trash and it's wrong. Did you find that was the case with your daughter?
Yes, and they'll mix in patient records. That's called a HIPAA violation. That's like not a good thing. To report it back, like, hey, you might want to check this. And I mean, it happens, right? But
yeah.
I mean, it does when you're requesting medical records all the time, but not all the time, but quite a bit. But that's definitely something that needs to be shored up. They're also they're also releasing mental health records on individuals that should not be released. That's a huge
that have not been consented.
No,
Wow.
even with consent, that is like not supposed to be accessible through the networks. That's a huge no-no. unless they're at risk of injury to someone else or themselves. That's not supposed to be there.
Oh, pulling through the national networks, it's coming through.
Yep.
Oh yeah.
Oh.
No, for sure, for sure. But are we? But why?
Well, it's
and unfortunately, why
intermingled
would
in
we be
some
surprised
cases.
though? We can't be surprised because there's no standard way
Yes.
of segmenting the data. Like that
That's
can't
right.
be a surprise, right?
No.
We're just hoping that like it doesn't get out too far, right? So this is like my gripe with everything health tech and data right now is that you have people being like, we're gonna just like, what are we gonna do? We're gonna buy and sell data faster. It's like people don't need that right now. They need ways to get meaningful information out of health
Yes,
data.
to take care
actually
of the individual.
spur
Yes.
action.
Yes,
Right,
yes,
right.
yes. Like, so you can see that historical timeline of a patient and be like, it pops off the page, right? You're like, oh my God, I didn't realize this happened 3 years ago. This would explain all this leading up to it, you know?
Right.
Things like
Yeah.
that. So that's,
Yeah.
so
Yeah.
it just needs to be deduped, but obviously very thoughtfully, but then segmented out, like you guys are saying, where there's diagnosis, medication, so you can just see it all together, all the diagnoses, what was started, what was stopped in a timeline. So that's what
But
we're
you know,
working
the
on.
other thing I would say about that though is one of the other ways. So we're doing some brainstorming at the
Yes.
Sequoia eHealth Exchange meeting about what are the harms that can be done by data moving faster, more data moving faster, right? You know, you can just like whatever. We haven't done much on data quality. We're just moving data around faster in the same structured in the document format. We've been moving it around for a long time. What are the harms? There are lots of harms. You can brainstorm plenty of them. One of them is the fact that there's pretty much zero way for a patient or a caregiver to correct incorrect data.
Right.
And you know, of course, that people, their data gets coded incorrectly. People hear what they want to hear. They might make a mistake. There might be something else going on. But let's just say, depending on where you are, that someone wrote in your chart that you had an abortion or multiple abortions, and you hadn't had an abortion or multiple abortions. And those data then follow you forever. And people say, how many abortions have you had? You're like, zero.
And
zero.
they're like, well, you have in your
doesn't
chart.
matter.
Yep.
It says here,
Yep.
it wouldn't be there if it wasn't true. Same thing with
Right.
opioid use or drug use or any other situation. You cannot fix it. You can't, there's not a structured way for you to get that out of your records. And then if your records have already been shared and there are copies of those documents or that data out in the world, it's still there. It's still there.
It's like what I tell my kids on the internet. You put a picture out there on the internet, poof, it doesn't matter. It's not like the Polaroid days where you could just, you know, destroy the one and you're done.
It's gone.
So
Just like our talk show. Just like our talk show, always there, always there, always dramatic. I mean, yeah. I mean, this is why I still have allergic rhinitis when I, in fact, have a terrible, life-threatening allergy to fire ants. I can't fix it. Like,
there you go. It's close enough.
Whatever, it's fine.
It'll work.
So you know, I know you got a real job. I mean, well, you know, Lisa and I have like a lot of real jobs too. But like, you have a real job that you're working, but you also have Unit 387. Yes. So tell us about like how does it work?
Yeah, so it's
what's going on?
Yeah. It's awesome. The great part is, I guess, you know, everything has a silver lining. So my daughter's physicians were like, if you get all those records and get them to us to let us look at that, that would be amazing. Then again, be careful what you ask for, because they're like 22,000 pages of records. What the hell am I going to do with this? So then based on their feedback on what they would like to see, because here was the other thing. They didn't want to just import all of her records into their EHR, even as a PDF, right? Because that's what a lot of them do, because that's 22,000 pages. Who's going to go through it? So now we're working on, they're like, yeah, okay, great. We'll have to pass on that for now. So what we're now concentrating on doing is not only aggregating all the records from around the US, but then also, because these providers and these patients, they know where they've been seen. Not that the patients do not have access to this. I will be clear, because that would be a huge problem. But we do know where they were seen. So we know if we're missing something, because that's the other thing. You don't know what you don't know. So we think that, you know, the emergency department or emergency rooms getting all the records on Meredith Mannett, but in actuality, how do they know for sure? It's just a hope and a promise, right? So anyway, so we go back to then dissecting that out to recent diagnosis, medications, whatnot, and then they can pull in those individual encounters that mean something to them for the specialist, and then it becomes part of their record. So that's what we do.
Awesome.
Yep.
And according to an article I read on the Commonwealth site, you're primarily pulling those records from Commonwealth and Care Quality.
Yes, an eHealth Exchange. A lot of them are coming from
God
that.
bless
We
you.
actually
God
do
bless Jay Nakashima.
yes. We're doing a lot of work with vets. So, and helping with their
Nice.
care coordination, just making sure, because they have so many, you know, health or vet facilities, right? But then they also have those community
Yeah.
partners that are outside of their network. And so it's really helping to bring that together in a streamlined, unified view. Yeah.
Oh, I love that. I love that. So
Mhm.
that's your primary, would you say that's your primary use case right now?
Oh gosh, yeah. Oh yeah. Yeah, absolutely. Treatment,
Ah,
coordination of care. Yeah. It's not about
Nice.
the patient
ah.
not allowed yet. We were up and then we were shut down back in April of
Really?
21. Yeah. For patient access.
So is
Oh,
that something that you're actually interested in TEFCA for, I would hope and assume? The only thing that I would say is still really relevant about TEFCA is making individual access services more standard and accessible. Is that
I would
something you all
think.
are looking at? Yeah.
We would always get in that game if it was there, or available, just because, again, if a patient is accessing, so what is a patient going to do with 22,000 pages of records? Same
Nothing.
situation. We're in
Yeah.
the same boat.
Nothing.
Yeah,
Print it
right.
out. Get
Exactly.
your
And they're
stack.
like, oh man, wrong, right, wrong, right. I don't know. It's crazy.
right, right.
Yeah.
That's freaking
Yeah.
crazy. I'm not
Mhm.
into it. Yeah. So what do you think about the changes to the common agreement then? Making it
I did
like,
not.
meh.
No. Okay. I'll back it up one more from there is that I was upset that I thought, so to speak, that if you were going to become a QHIN, you had to use like a uh, patient master index or a master patient index, or have
No.
some type of record-location
No.
service. That's not the case anymore. So
Mm-mm.
what the heck was that
Mm-mm.
point? And then,
No.
so I got really fired up over that because this is ridiculous. Like this whole geofencing thing is bullshit. I'm just going to say it right there. But
Right.
I've learned how to work the system. Let me tell you, it's not as easy as they claim it is. It's not. Bullshit.
I'm here for it.
Sorry, I get very heated over this
Yeah.
because I know where the patients are because their providers tell us, right? So like, but wait, I don't
Right.
have such and such, such and such. And I'm like, that's interesting. So then I go specifically, I'm like, hey, we didn't get any information back on you. Well, it wasn't quite the right patient match or something along those lines. So we have learned to do it and do it again. But then it's not just as simple as like my daughter, like we can never get her Mayo Clinic records for Dr. Johnson. Well, we live in Dallas, Texas. Mayo Clinic is in Minnesota. Why weren't we getting into those? Even though I put, hey, she was treated at this facility. Things like that.
Ah.
Mm-hmm.
It's tricky. It's just not as cut and dry as it should be. I mean, it's a game. I'm
Yeah.
so
Well,
annoyed.
Well,
the
I
the
actually think
location. Okay, go ahead.
the location thing. So I think that basically, if you look at even if you look within eHealth Exchange or others, sort of their records, you can see that the vast majority of treatment based exchange happens locally in
Right.
close region. But when you have patients who have serious illnesses, chronic illnesses, patients with more complex things going on, they're probably going to be going to Mayo
Yes.
Clinic or whatever. So it's a
Right.
different use case, but really important as well. And it's hard to figure out, like, okay, local exchange mostly, but then like trust someone and they say like, I went to Mayo Clinic, right? It's a
Right.
tricky one.
Or if they've moved around. I mean, if you had moved
Right.
more than 50 miles out so then what? And
Any point.
so, yeah.
Yeah.
It's just,
Like
it's
me.
defeating the whole purpose. Why are we still doing this again? It is just a repeat of the same
Yeah.
mistakes that were made
Agree.
last
It's a
year.
load of bullshit. It's a load of bullshit.
Yeah,
Little
totally.
So I
bullshit.
get super mad about location stuff because disclosure alert. I worked at and continue to spend a lot of my time with Collective Medical, now Point Click Care, and like one of the most incredible things about that company is that like there wasn't any sort of like this is the patient zip code, right? It was like they had a very good
Yes.
MPI that was internally built, and it didn't matter what freaking state you were in or what county or what bullshit.
Right.
And it was like the most relevant information. So the difference is it wasn't returning massive records, but it was returning the most important information on like a criteria that would say to an emergency department, blah, 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 this person probably needs some extra attention. And I get so mad. I just got in a fight on Matthew Holt's talk show, which, our show is better. I'm just saying.
I'm just saying. I agree.
I'm just saying. But yeah, people were like, oh, patients don't move that much. And I was like, I could show you so many maps of where, especially the underserved, right? We're really moving around a lot, like all up and down California, into Oregon, like everywhere, right? And then they're flying to New
insane.
York City, right?
Yes,
It is
yes.
crazy how much patients move. And even like Lisa and I, right? We travel every freaking week. Like, you know, maybe
So what if you're in the
we're
ER?
going to sprain
Yeah.
our ankle when we're drinking. I don't know what's going to happen, right? Like,
You don't
I
know,
get so mad. I get so mad when people say people don't move around. And yeah, I think that's total bullshit too. I'm here for it.
And that's
so
why
I'm
I
like
love
mad now
Commonwealth.
because
Yeah,
God bless
they
Con.
do
I
that.
agree.
That the RLS. It's just freaking phenomenal. But some of the things that they're doing to help shore that up is going to hopefully alleviate the other players that aren't playing so nice.
Also, disclosure alert, I am a member of Commonwealth. They do not pay us any money. Lisa is on the board of eHealth Exchange. It just turns
I
out
love
that
We don't
eHealth
pay me any
Exchange.
money either.
there are two favorite QAnon candidates. So weird.
I know, right? Yep.
Yeah. It's freaking
I just want to give you
bullshit.
an update on ChatGPT, which says there are no secret Q hands. Now, I don't know if it's true, but it claims that.
Okay.
However, it does remind me, it did remind me in the process that NextGen originally announced that they were going to apply, but I don't think they've actually moved forward on that. And then, of course, NextGen was bought by, I think, a private equity firm. Sorry, NextGen friends. And then there was some turmoil there. Thoma Bravo. So they are still out there floating around the world, maybe planning on moving forward at some point still, now that they've probably started to stabilize their operations after the acquisition. So maybe they are the secret announced QHEN. You never know.
We don't know. We don't know.
We don't know.
All right. We got to move to our potentially might not work video of Tom Novak, and then maybe we'll have time for career advice. I don't know. But Meredith, what would you like to leave us with? All providers should sign up for Unit 387.
Yes, for sure. And on Commonwealth. Cool. I'm just going to go out there and say it. Just
God bless Commonwealth. Right, God bless Paul Wilder.
Or eHealth Exchange. Sorry. I like them both.
Whatever.
Or God bless Jay
Whatever works, right?
Like both of those guys. Yeah. No, thank you for coming on Friday and Saturday. We know it's not the most convenient time. It's fine. It's okay.
No, it's all good.
You're the best. Thank you, Meredith. Thank you, Meredith.
Right.
Did we just
Can you do this tech thing?
Jesus, Lisa, I don't freaking know. Okay. All right. So here's us again. All right. So we'll try Tom's thing. This is a really bad picture of many of us on the late night at Solome's conference, Behavioral Health Tech. That's Matthew Holt. The actual live big picture is worse than that even. That's Tom. This is Kate. There's Emma and Nadine, our number one super fan, sometimes correspondent.
Nice.
And let's see if Tom's video works.
All right, listen up. This is your remote correspondent for the Health Tech Talk Show, Tom Novak. I'm not here in any official capacity. This is a Saturday.
Oh my God.
I'm off the clock. Reporting about the Behavioral Health IT conference. There was this past week in Phoenix. I got back yesterday. It was great. It's called Going Digital, organized by Salome Tibabu, who was, I think on the show, I think it was last week. It was great. Great. They had a lot of social media things on like LinkedIn and other platforms leading up to it. And, for those of you who've been, knocking around a while, like, you know that before conferences, you get a lot of like LinkedIn direct messages saying like, hey, I see you're on the agenda. You're going to be speaking. Let's hang out. Let's get coffee. Let me tell you about my company. And, you maybe look at these with some skepticism. You maybe do a little bit of Googling and determine that some of these companies that want to have coffee with you look hokey. So, guard is up. Been around a while. But leading up to Salome's conference, I was getting these messages. I was getting a lot of these messages. But doing my due diligence and looking at the companies, they were really good. Like, these companies seem very legit. And, the percentage of DMs to the size of the conference was impressive. So, like, it's not a big conference, but I was getting a lot of outreach. So it seemed like a cohort of companies that was eager to network, and it seemed like wholesome, sincere networking. So that was interesting. So already I was like sort of thinking like, oh, this is may be something to do this. So, get to the conference, and this is going to make me sound cynical, or further cynical, more cynical.
I should have sped this up. They like the 1.5.
a lot of us who've been knocking
know.
around a while find that you can just have a very productive conference by hanging out in the lobby and having all the hallway conversations.
That is something
Those
you
are
say,
really where
Kat,
you
to
can
be fair.
be very productive and get a lot of deals
Hey,
done
he's
and
just
make a lot of
copying
new
me.
relationships, and you connect this person to that person, and they can go make some magic happen. And the sessions are sort of like an afterthought. This was not the case. The sessions at the conference were great. The percentage of sort of like VC tech bro companies to
This will be over soon,
companies
y'all.
that were like founded by a mission-oriented person who had either some sort of behavioral health situation themselves, or a loved one did, or a substance use disorder situation themselves, or a loved one did. Like, it was very heavily skewed towards that sort of mission-driven, like, I've been through this, I'm gonna go solve this problem kind of company. So that was great. The sessions were very much to that effect. Like, they were, people out there
That's
looking
kind of what you
to,
do,
find a
Kat.
problem, figure out a problem, and like, their questions were good questions. Their questions were like, this is, in my experience, sometimes people just walk up to you and they're like, hey, what building code do I use to get, someone to pay for my thing? As opposed to this conference, where they're like, okay, explain to me, all of the stakeholders I should talk to. Like, I want to know everyone I should talk to make my product as good a product as possible. So I like that. I like that sort of like openness to collaboration and in building that feedback loop. So, thumbs up, Salome. You probably had a team. I didn't really interact that much. Adina was great. Adina in the Medicaid sessions. But back to you, Kat and Lisa.
Wow.
Okay.
Just a cat. Brutal.
No, it's cut off. I cut it off. It said Cat and
Okay,
Lisa.
okay.
It did
Fine.
say that. It did say that.
Wow.
And let's all remember that Tom was your
Fake
friend
news.
first, so he definitely was
Yeah,
thinking
I was
about
gonna
you
say,
more than me.
fake news, but sure.
It might have been fake news. No. But I agree. So I had a really good time at this conference. Yeah, like the caliber of people that Salome was able to attract, it was like awesome. Like the sessions also were good. I actually went to a few, which is super unusual for me. And it was great. And I got to present with I have a picture of them, my delightful co-panelists here, showing this
Nice.
picture because you can see Botox definitely taking effect there on my face. I just wanted everyone to see it. But the middle speaker here, this is Daniela Tudor, and on the right is Dr. Casey Claiborne. Daniela runs WeConnect, which is an online platform, obviously online because this is the Health Tech Tax Show, but she does a lot of peer support work for SUD. And then
Nice.
Casey is, she's the director of the Addiction Research Institute, and she also is a professor at UT Austin. So total freaking killer. We talked about opioids and technology solutions and things like that. Matthew Holt
And by
came
the
to
way,
our session.
I didn't even bring a picture of my session at the eHealth Exchange conference. Sorry, everyone. It
I
was
know.
amazing.
No, I should have pulled it. I commented and I said this is definitely the best session because
Mm.
Lisa's here. And then sure, I made all the panelists mad, but it doesn't matter because everybody knows that. Everybody knows that and expects it. So it's totally cool. Yeah. But no, it was a really good conference. Lots of really interesting people. And I learned that
Yeah.
Lisa and I, while we do not actually often travel to different conferences and not together, I learned that I will not be going to any of these conferences by myself in the future.
It's not good. It's not. You need to have a little bit of a crowd. You need a little crowd, a little support.
I got lost.
Yeah.
All kinds of things happened to me.
Yeah.
So anyway, but
Yeah.
it was really quite good, and I was into it. So, what's your hot take from from your co-located conferences?
Yeah, I mean, so I moderated a panel with a number of HIE leaders across the country, which was called Trickle Down TEFCA, which I was like, first of all, I'm not a big fan of Reaganomics, but Trickle Down TEFCA does sound pretty hilarious to me. Whoever came up with that, probably Tina Feldman, amazing, hilarious. The thing was, like, for all of the talking about like TEFCA and the national networks, of course, there's like very little discussion, of course, about how it's actually gonna work on the ground and what the barriers are today. And I would say that our panel was like the only one that really went into detail about what was actually a barrier to making TEFCA work on the ground. And nobody wants to hear that, right? They all want to do the rah-rah, but like actually getting into the details of implementation, that's what I care about. That's what I do. Like, Are you going to actually
Yeah.
make it work on the ground? That's the unsexy, unfun, like boring snooze part of it. But it was a great panel. My panelists were all very compliant with me yelling at them and telling them what to do. They did whatever I said. It was incredible. They were also
Love
very smart.
it. Love it.
They were
Yeah. Well,
very smart.
they were smart enough to know what the rules were of this panel. So I think that's fantastic.
They did.
Yeah. I mean, I don't know. I'm so bummed about the patient access thing that like, I don't even care anymore. Like, I'm
Dude,
like, well,
I know.
that was all I gave a shit about. So, maybe they'll do this thing.
Yeah.
Everyone says, oh yeah, government does incremental things. Like that's fucking great. But, it seems like they unincrementaled it and just like went backward. Like there's no like caterpillar inching forward. It's like,
Yeah.
we just were like, it's a little hard. We're
Yeah,
not gonna do
it's
that
really
anymore.
hard. It's really hard. It's really hard. And I just think again, like, I am extremely for patients getting access to their data, but I don't know if this is really going to help them, and I don't want them to be taken away from any of the other important things that are happening to get patients more access to their data. Like, please, like, let's find a way to make it easier. It should be really easy. It should not be 22,000 pages or whatever. It should be something they can have automatically without having to fight for it. So I don't know.
Yeah,
I mean,
it's a
that's what
bummer
Grace
too. It's gonna
Portavano
be in
would
those
say.
big old CCDs, right? Like it's gonna be just like trash. She's just gonna get trash, which is unfortunate. So I'm bummed about that. Your
Moving
panel, I'm
trash
sure, was definitely the
around.
best. I'm sorry that
It
I
was
wasn't
great.
there, and
Great.
it didn't. That was fine. Next time. I'm gonna hear you speak at Vive. It sounds like.
Yeah. So speaking of my favorite / least favorite topic, TEFCA, which is all anyone wants to talk about right now, I will be talking in some way, shape, or form about what's happening with TEFCA on stage at Vive in February in Los Angeles, and more to come there. But that will again be sort of a fun one, right? The health Vive people do know how to put on a good conference. And it looks like we may
Correct.
be doing something with the talk show there too. Stay tuned. We don't know what it is yet. We have no idea.
It's because we're so famous. We're so famous. But yeah, I'm speaking in Poland week after next about commercialization, regulatory, making money, one of my favorite topics. So that's really great. But then I'm kind of done for the rest of the year. So we all have to go to Lisa's thing. It's going to be fantastic. My hot take from this behavioral health conference was mostly that it finally seems like people care and there is a market there, right? It's like not so much the early adopters who are pushing. It's like the market's there. We're at the point, we might be at the point where SUD is no longer quite the horrible stigmatized diagnosis, right? So people are more willing to get help and all that. I think that's kind of key. But it was really cool to see a lot of the founders there. It was kind of a wild conference because you'd go to the bar, right? Where everybody goes to the bar, right? Everybody knows that. And you'd be talking to someone and I'd be like, how did you get the idea for your company? And they'd be like, well, I woke up on the prison floor for the 4th time and I thought, I'm gonna do something about this. It's like stories like that. So it was very, much more emotionally charged than most conferences I've been to, just because most of it was like lived experiences that had turned into a company. So very cool. Yeah.
Nice.
Well, I don't know, Lisa. We might have time for like one more of our Mighty Eagle questions. I don't know.
I will just give you I got the real time update on the OpenAI situation. Unsurprisingly, Sam Altman is founding a new venture. It was just released a few moments ago on The Information, which is London's tech news. New venture in AI, going to involve making better chips, going to involve SoftBank. Very controversial, massive investment fund, including many sovereign wealth funds. They were involved in the hilarious debacle that is WeWork, so it could all get continuously interesting and fun from here on out. So more to come.
Who also tried to take sovereign funds?
Who did?
It was an entity.
I feel like
Idaho.
You can say it.
The Idaho Data Exchange was going under real hard, and they made an announcement that they had received a philanthropic donation. I think it was basically this is the details that I recall. They may not be accurate. That this sovereign wealth fund, which was also a philanthropy, said, "If you give us $2 million, we'll give you $4." which sounds like every email I've ever gotten to my multiple Gmails junk folders.
Yeah.
And so that didn't work. So I don't know. You know, I personally would be a little nervous about taking money from the Saudis, but
Well, I think SoftBank just has a really, as far as I can tell from the very, very outside, not a great reputation for, sustainable growth, let's call it, or funding good stuff. So TBD on that, Sam. But, probably has more money than God. So who
who
cares?
knows?
Who
So
knows?
there was a conflict, and the altruistic board people said, "You're out, bro."
No. Yeah, they said no to that.
Hmm.
Well, I think
Good
that's
report.
it.
Good report.
Yeah.
That's it. We're out of time. So we just decided on this show that we are not doing a show next Friday because it's like Thanksgiving. But maybe we'll have some hot takes on the internet. We don't know. But join us on whatever day the next Friday is,
Whatever
which
the after
might be
Thanksgiving is.
December 1st. I think it's December
Maybe.
1st. We'll be back on December 1st. We have time to plan. It might be good, might be bad. We don't know.
Who can say?
Anyway, all right. Happy Saturday to all y'all. Thanks for coming. Goodbye.
Bye.